Alright guys, today I'm going to talk about cancer in domesticated animals. We're going to cover just dogs, cats, and horses. This is kind of just a general overview. Obviously there's a lot that goes into such a broad topic, so I'm just going to kind of skim the surface. So to kind of define what cancer is, it's an uncontrolled cell growth of abnormal cells. So I kind of laid out here what happens. Typically, the body's normal control mechanism stops working. And so the old cells in the body aren't dying. They start to grow out of control. They're forming new abnormal cells, and that DNA is being replicated. So now we have all these extra cells in the body that are starting to form masses of tissue called tumors. And so in this picture right here, you can kind of see these are your normal cells. You have a few abnormal cells that pop up. They kind of start to replicate, they multiply, they start to form a mass of some kind. And then they start to form their own blood vessels, which is what angiogenesis is, and then they become malignant in some cases and invasive, which is where we get into some problems. So we define our cancer tumors into kind of two different groups. So we have benign and malignant. So benign is definitely preferred. It's slow growing. It has a capsule, so you can kind of see that in this image here. It's non-invasive, so you see that these cells are contained in their capsule. They're not branching out like in this photo. So they're not metastasizing and infecting other areas of the body. They're kind of contained to this one spot. And so when you're hearing all these different types of cancers and what their names are, you can kind of determine whether or not it's benign or malignant simply because of the name. So if the suffix ends in oma, it's typically benign. If it ends in carcinoma or sarcoma, it's typically malignant, which is not great. Because as you can see, these are fast growing, they're going to spread throughout the body and usually result in death if not caught early. So here's a table I made of some common types of cancer that we see in a lot of domesticated species. So I'll go through these in more depth in a minute, but papilloma, these are benign skin tumors. They kind of look cauliflower-like. They're very warty. Lipomas, those are the ones you usually see on those old labs running around. They're like big fatty tumors. They're usually pretty mobile. You see those a lot in older dogs. Sarcoids, we see those a lot in horses. They usually start off as like gray scaly hair patches. Then they eventually turn into these little ulcers that look very painful. Then we have melanoma, which is common in both people and animals. We see this a lot in gray and white horses. Squamous cell carcinoma, common in cats. Lymphoma, common in all animals, and then osteosarcoma, which we see a lot in our larger breeds. So here is papilloma. This is obviously a canine mouth, but you can see that the growths have just kind of overtaken all these different areas. This is an example in a cat. You can kind of see that there are color differences, so it's not always going to appear the same exact way. Here's lipomas. So obviously this is a very severe case. This dog's entire back has been overtaken by this lump. You can see the underside here of this dog. There's some little ones here on this dog's back and sides, and then this is a cat. So these are present in several species as well. Here's some other images. This is a sarcoid. This one is progressing past its little scaly gray stage and turning into that ulcer that we're seeing. Squamous cell carcinoma, we see this a lot in cats, on their noses and their faces especially. A lot of tumors can actually grow inside of the nose, so owners don't even know that their cats are, growing this mass inside, and they get pretty severe as well, and usually are treated with radiation. You can see here in the inside of the dog's mouth, which is why our examinations of the mouth are super important, so we can catch these things before they get severe. Here's an advanced case of sarcoid. You can see that it's overtaking this horse's side of its face, and then some melanoma. So this can actually occur in the eyes and all over the body and in the mouth. So it's important to look for those discolored moles, discolored areas, and notice those changes in your pets. Lymphoma has kind of its own slide because it affects a lot of the animals that we see. It's very common. These are the common lymph nodes within a dog. Where we see a lot of these kind of pop up is in the mandibular region, under the armpits in cats, and then the popliteal region of the back of the leg. So you can see this boxer here has a large lymph node underneath his neck in his mandibular region. So these are cancers of the lymphocytes. So these white blood cells that are supposed to help with the infection are actually what are causing this cancer. And they can spread all throughout the body because they have the ability to go from travel in the immune system to go everywhere in the body. So that's why these become so severe if they go untreated or are not caught for a long time. Then we have osteosarcoma. So these cancers develop within the bones. They're often incredibly invasive and metastatic. They're relatively rare in small domesticated animals, so smaller dogs, we see this less often. Larger dogs typically will get it in their front limbs or their back limbs. It's less common to see it in like the main part of their skeletal system, but it does happen. It's rare, but all dogs that pretty much have a bone tumor, it ends up being osteosarcoma, so it's safe to kind of assume, but obviously more diagnostic tests are needed. But the larger the tumor size, they say, is typically poor prognosis. So if you do see something like this pop up, it's better to get it checked out sooner rather than later. Most veterinarians decide just to amputate, so there's not a risk of that spreading any further. And here are some pictures of osteosarcoma. So you can kind of see the discoloration. It's not like a white solid bone. You start to see the growths bump outwards. You see there's like bone loss. There's a lot of fuzziness here. You can tell that the cancer is overtaking that bone. And this is a picture of it in a live dog. So symptoms and signs vary greatly between types of cancers, but these are some typical ones that you might see. The lumps and bumps that kind of pop up are the obvious sign, but there's also wounds that won't heal. There's swelling and large lymph nodes. Your dog or cat or horse might just start to become lame. They might have some swelling in their bones. Might be bleeding abnormally. They might have difficulty urinating. That might be a sign that they have cancer in the bladder, like TCC, which is transitional cell carcinoma. They might be losing weight or having difficulty breathing, might be too tired to do anything, vomiting, diarrhea, seizures, and offensive odor is often a common sign of something going on in the mouth, especially, because they could be growing some nasty things in there. So it's important to get those checked out at your annual exams. So diagnosis. Usually these things are caught at your annual exams. For your dogs or cats, the veterinarian kind of palpates all over looking for these things. If they find anything, they might do some blood work or fine needle aspirates, which is where they just take a needle, poke it, put it on a slide, and see what those cells look like. That's more common for like adipose tumors, and usually it'll look kind of oily on your slide. But if they suspect anything severe, they might do an ultrasound, radiograph, urinalysis, or a biopsy, which is where they kind of take a bigger punch removal of that tumor or lump and kind of see what it is and determine its characteristics. And if they do find that it's cancerous, they'll evaluate it based on the breed, the size, location, the age of the dog, and everything like that, and kind of determine what's next. So cancer can be caused by several things. It's not really something that people have nailed down. That's, if we did know that, we obviously would have less cancer. So common things that we do see contributing are like the environment or genetics. So here's a list of different environmental contributors. Smoke is turning out to be a big one because dogs can suffer from secondhand smoke as well as people. But genetics are also playing a big role because we see that purebreds have a higher chance of getting cancer because they have that predisposition because their gene pools are smaller. So crossbreeds or mutts tend to have less mutations like that. So cats specifically, 1 in every 5 cats develop cancer in their lifetime, which is a pretty big number. So most of them suffer from lymphoma, soft tissue sarcoma, or squamous cell carcinoma, which is some of the ones we talked about earlier. And that's why it's important that cats get like their feline leukemia virus vaccine because it actually can prevent lymphoma from popping up. Because if they get FELV, then it won't be able to like protect them from getting lymphoma. So it's important that they get these vaccines because that'll help prevent other things like cancer. Fibrosarcoma is also something that we kind of see at injection sites of vaccines, and we're hoping that that can be like more prevented in the future as well. Maybe if there's like a new procedure to come out to like more safely administer these vaccines, and maybe we can prevent those from popping up. With horses, cancer is a lot less common than it is with people, but they do have melanoma, squamous cell carcinoma, sarcoid tumors, reproductive cancer such as prostate or breast cancer, but lymphosarcoma or lymphoma is the most common. Like I said before, melanoma is really common in these guys, probably due to their light skin and their breeding. But unfortunately with horses, if it's suspected that they have cancer, it usually goes undiagnosed for a long time, and it typically is fatal because they didn't catch it soon enough, because they're not around them every day. With dogs, cancer is the leading cause of death in the age over 10. But most of these cancers are curable if they're caught early enough, but unfortunately people don't always know how to pick out those signs. We see a lot of these in golden retrievers especially, so breeds do have specific cancers that we start to see patterns with, so it's good that if you are going to get a dog that you kind of look out for that and recognize what your dog is more prone to, so you can kind of be on the watch and hopefully catch something before it becomes severe. Most common cancers that we see in dogs are mast cells, which are skin cancers, melanomas, lymphomas, osteosarcomas, and then one I haven't mentioned, which is hemangiosarcoma, which is a cancer of the blood vessel walls, which can be pretty severe. So common treatments that are used, radiation, chemotherapy, and surgery are the main ones. We use all of those in human medicine as well. They are doing new research in immunotherapy and tumor vaccines, like the feline leukemia vaccine, the melanoma vaccine. There's also some clinical trials going on. A lot of vet schools take part in that. So with surgery, the goal is either to completely remove the tumor or the cancer, to debulk it, which is kind of just remove most of it so the animal is having like a better quality of life, or to reduce their pain. Chemotherapy is usually just to shrink it or stop the growth, destroying the cells that have cancer in them. We administer them very similar to how we do in people, and we even use a lot of the same drugs. With radiation, we have two different types that we will consider. So we have palliative or definitive. Palliative is simply to reduce pain and swelling of the animal. We do this here at Purdue University. Usually that goal is not to reduce the disease, it's just to simply keep the animal comfortable in the remaining days or months that it has. Definitive radiation, though, is used to actually treat, and it's to remove the tumor, or can be paired with chemotherapy and surgery, so that hopefully the animal will be cured. So overall, the cost can get kind of pricey. Usually your diagnostic stuff will cost anywhere between $200 to $1,000, and then treating can range from $1,000 to $15,000 if you are getting just chemotherapy, just surgery, or if you're having to do several rounds of chemo or change your chemo. Now they're even considering doing bone marrow transplants, which would be very expensive, but it's something to try. So prognosis, remission versus cured. Dogs in remission usually still have the cancer, but they can't find it during that time period. So remission is a good thing, but it does mean that the cancer can come back, and it does not mean that your dog is completely safe or in the clear, or that your horse or cat is in the clear. And every time the cancer returns, it'll probably be more resistant to the chemotherapy, so the odds of curing it decrease significantly, or the odds of going into remission also decrease significantly. So it's important to catch all of these things early, so hopefully that first dose that you're giving, you can completely destroy all of the cancer cells. But all of this depends highly on the cancer type, but lymphoma can usually be fatal if it's not caught. So how do we prevent this from happening? Like we've said before, keep an eye on your animal, go to those annual checkups. Make sure they're looking in the mouth and in the areas that your dog does not want touched. It's better for them that way. Make sure that you notice any foul smells. You're keeping your dog in a healthy weight so they're not more at risk for those fatty tumors, and then spay them and give them vaccines on the timely schedule and at the correct times of their age, so that you're not inducing them to something potentially dangerous. Those are my sources.
A lot of sources. Let's give her a round of applause. It's kind of like Cancer 101, wasn't it?
Yeah.
I mean, really, it was very comprehensive, so good job. I'll let you point to people, Sam.
Oh, yeah.
When you mentioned melanomas in horses, you said that it's likely it's more common in grays because of their pink skin. Grays actually have black skin, like most other horse colors.
Well, it's also due to the breed. So the breeding of gray horses and white horses. So they both, because of the gene pool, are more likely to have melanoma. It's 70% of them after a certain age.
I have a gray, and by breeding, what do you mean by that? Because it's not a specific breed, it's a color that occurs.
Right, it's the lineage and the color traits carried in the genes.
That's because the way that they gray is due to a change
Now, isn't a gray horse when it's born not gray?
No, it can be any color.
It can be any color, then it turns gray, what about?
It's a color, yeah, it's a color modifier, not a
Yeah,
color.
2-3 years down the road.
Yeah,
turns gray.
it depends on the individual horse. Some will be gray by 4, some won't be fully white typically.
One of my sources said that like 70% after I think it's like
Yeah.
age 15 will get diagnosed with melanoma, and
They
a
usually
lot of them
don't.
are benign, but it's still something to like look out for. But they said that it's due to like it being carried in a gene, so I don't know if that is like necessarily always the case because it does differ between.
Every gray I've known has had one. So like you said, 70% is probably about the number.
That's interesting.
But some of them will get one and it'll never show up again. Other horses will be covered.
Other comments, questions? It's a big field. I mean, you know, the cats with the vaccine-induced sarcomas is interesting. Somebody told me that it's not always just the vaccine. Sometimes if you inject saline into a cat, sometimes there'll be a tumor develop where that was at, which is really mind-blowing.
It's also with insulin.
Oh,
It's like
insulin?
sites of injection,
Yeah, so it's really crazy how you can
the
induce,
body's reaction.
yeah, the sarcomas into cats that are like not really a bad